Joining us now to discuss is Peter Pitts. He's the president and co-founder of the Center for Medicine in the Public Interest. Peter, last time we talked about the idea of social distancing and how important it is right now. Clearly, people who are unable to do so are healthcare workers. They're on the front lines of this situation, and we're hearing potentially of more and more being diagnosed with cases of coronavirus themselves. Can you tell me more about that, as well as whether or not hospitals are prepared to deal with new patients?
Well, certainly, some people are going to be more at risk than others because of their professions. Clearly, healthcare workers are at the top of that list as well. Firefighters, police officers, public safety officials. And that's the risk that they take. That's the careers that they've chosen. We've got to support them and applaud them for those efforts. But we also have to recognize people who are doing additional cleaning in the New York City subways, for example, who are trying to keep our environments clean and sterile. There are a lot of people out there. We need to support them. As far as hospitals go, we need to start increasing the availability of beds for the potential of worst case scenarios. This, of course, does not mean that worst case scenarios will play out. But I think, from an abundance of caution, we've got to have those beds ready, whether it's using the Army Corps of Engineers, whether it's allowing certain rules to be relaxed so hospitals can use more space for patients. I think all those things are in place. And that's why when the administration of Washington talks about relaxing rules, it means giving hospitals, as a good example, on the local level, the ability to do more things more quickly than they might otherwise have done.
Let me ask you about social distancing here, because it's easy to say, stay 6 feet apart, don't shake hands, got it. But you just talked about it. You're in a hospital. You're going to be back and forth, shoulder to shoulder. You're going to be working with people. There are going to be times where that's just not going to happen. You're going to the checkout counter, everyday life. You're going on the subway. It's not going to. How do you? Are you saying just do it as much as possible? You know what I mean? How do you relate that to people?
Under the best of circumstances, pre-COVID, when you get out of bed in the morning, you're at risk for just about 1,000 bad things that could possibly happen to you. You have to take it in stride. You have to recognize that we're all in this as a society. We can't all hunker down and crawl down into fallout shelters with 6 months of canned food. We have to live our lives. So people are going to be more at risk than others. And they're doing that for a reason. They're doing it for our benefit. We have to recognize that. I think once we get past all this, we've got to do something relative to the heroic acts these people have put forward.
Yeah, in the meantime, we've seen a lot of people stockpile on groceries and other household items, unfortunately. But, I want to ask, it seems like maybe we could be on track to be like Italy. Is that true? Are we a few weeks behind in the number of cases? Can you bring us up to speed on that?
Well, clearly, testing is going to be one of the key metrics as to how we're doing in this country. I think we're doing much better than many countries. Italy is a different type of culture. It's a different environment. It's hard to compare. It's not an apples to apples proposition. Relative to people running out and buying ammunition or running out and buying 6 months supply of toilet paper, that's inappropriate. It isn't being a good citizen. We have to be part of the solution rather than being part of the problem. And part of that is recognizing, not seeking blame, but seeking solutions. And I think as we move into more and more of a social distancing COVID experience, we're going to recognize that as a society, we need to pull together to make this go away. And I think we're going to succeed.
Let me ask you this really quick before we go here. Why is testing, aside from the obvious reason, why is testing so important?
Well, you don't want to get tested unless you have symptoms. But if you have symptoms and you are tested, you want to understand what the condition you have is and how to deal with it. For the overwhelming majority of the population, COVID will be a couple of days, 2 weeks of not feeling well and then getting better. Obviously, there are more at-risk populations, and you've got to test people to understand where they are, what they've got, and how to treat it.
So you don't need to run out and get those testing done unless you truly do feel symptoms.
Unless you've got symptoms, there's no reason to be tested.
All right. That's Peter Pitts. He's the president and co-founder of the Center for Medicine in the Public Interest. Peter, thanks so much.
Thank you.